My name is John Fitzgerald, District 3 City Councilor. I'm the chair of the Boston City Council Committee on Public Health, Homelessness, and Recovery. Today is February 22nd, 2024. This hearing is being recorded. It is also being live streamed at boston.gov/city-council-TV and broadcast on Xfinity Channel 8, RCN Channel 82, and FiOS Channel 964. Written comments may be sent to the committee email at ccc.swfc, again, ccc.swfc@boston.gov, and will be made a part of, for the record, and available to all councils. Public testimony will be taken at the end of this hearing. Individuals will be called on in the order in which they signed up and will have 2 minutes to testify. If you are interested in testifying in person, please add your name to the sign-up sheet near the entrance of the chamber. This is virtually. If you're looking to testify virtually, please email our central staff liaison, Megan Kavanaugh, at Megan, MEGHAN, .Kavanaugh, KAVANAGH, at boston.gov for the link, and your name will be added to the list. Today's hearing is on docket number 0191, a hearing to discuss the continuity of healthcare services in relation to the financial challenges faced by the Steward Health Care System. This matter was sponsored by Councillor Braden, myself, and Councillor Worrell, and was referred to the committee on January 24th, 2024. Today I'm joined by my colleagues in order of arrival: Council President Ruth C. Louis-Jean, myself, Councillor Liz Braden, Councillor at Large Aaron Murphy, Councillor Ed Flynn, Councillor Enrique Pepin, and Councillor Sharon Durkin. My hope for this meeting as well is to really get an understanding for both ourselves and for the folks that are watching what our options are at the city level of what the next iteration of Steward hospitals within our city are going to be. I think that should be the main focus. Of course, there'll be some interest as how we got here. But I think right now, with time being of the essence, we have to look to the future, how the continuity of services continues and what that looks like and what our options are. I'm now going to turn to my colleagues in order of their arrival for their opening remarks. We'll start with you, Council President Ruth C. Louis-Jean.
Thank you, Councillor Fitzgerald, and congrats on chairing this first hearing. I just want to thank you for holding space for this conversation. It's a matter that matters so much to our residents, for you in District 3, Carnegie Hospital, to St. Elizabeth, Councillor Braden, in District 9. I want to make it clear that those hospitals are doing yeoman's work in very difficult situations. You, myself, a number of our colleagues went to Carnegie Hospital recently and saw how much that they were doing, how much incredible work that they're doing despite these financial challenges. So many of us have connections to these hospitals. My godmother who goes to Carnegie Hospital. So I want to make it clear that the issues here are really due to the leaders of Steward Healthcare and what happens when we put such a strong profit model in healthcare, where private equity is making decisions on the financing of hospitals. So I think that hopefully we can, as we're looking to the future, we can talk about ways to disincentivize such a strong profit model when it comes to meeting the needs of our communities and healthcare in our communities. I want to commend the governor for her strong letter to Steward Healthcare for their failure to provide financial records to the state, to the Department of Public Health, who has been demanding this information. We see it happening throughout all of our neighborhoods, whether it's the closure of pharmacies or the financial challenges of hospitals, and it requires us to make sure that we are fighting for different models, for nonprofit models, for community hospitals that really care about people before profit. So thank you again, Chair, and I look forward to this discussion.
Thank you, Council President. Councillor Liz Braden.
Thank you, Mr. Chair, and thank you for chairing this first hearing for today. I think you hit it on the nail on the head when you spoke about we are in a crisis. It's maybe not that useful, not that valuable to spend a lot of time talking about how we got here, but really at this moment we have to focus on the way forward. The Steward crisis has serious implications for hundreds of thousands of our most vulnerable patients across Massachusetts, and here in Boston they have a significant footprint. In Austin, Brighton, St. Elizabeth's is the largest employer. They've existed for over 100 years and provided wonderful care and support for our neighbours in the district for a long, long time. And they're also a tertiary care hospital in the Steward network, which means that folks from all over eastern Massachusetts and as far away as Springfield come in to get care at tertiary care at St. Elizabeth's. So, you know, this is a serious crisis that we're dealing with, and I'm so glad to see Dr. Ojikuto here and Lou Mandarini and the panel from the different panels that are going to be speaking about this issue today. I think it behooves us just to really focus on solutions as much as we can possibly at this point. This crisis goes way beyond our scope, but we are here to articulate the needs of our communities and try and advocate for a timely solution that will move us away from this for-profit model that is not working and return to a semblance of more of a non-profit situation that will support our most vulnerable communities and our most vulnerable neighbours. So thank you, and thank you all for being here today.
Thank you, Councillor Braden. Now on to City Council at Large, Erin Murphy.
Thank you. Thank you for convening. I do want to thank Dr. Ojikuto for being here. I wasn't sure if you would be, but I know as the former chair of public health, we worked closely these last 2 years, making sure that we're advocating for all our healthcare centers, if it's Boston Medical, also our community healthcare centers. And the Kearney is in my neighborhood, the second largest employer next to UMass, and St. Elizabeth's, like you just mentioned, Councilor Braden, the #1 employer. So it's obviously the healthcare that we need to make sure continues for the communities and the neighbors, but also so many. And every time I visit Kearney or talk to employers at any of these Steward Healthcare, many of the nurses and the staff have been there 10, 20 generations. They're having like grandchildren now from parents that they maybe delivered babies to. And when St. Margaret's closed, my OBGYN care went over to St. Elizabeth. So for many years, I was a patient there at St. Elizabeth. So losing these institutions is going to put a burden on the other healthcare systems in our city. I saw yesterday Congressman Lynch and Senator Rush toward some of the other Steward Healthcares, and we all heard the governor's strong statement, which I'm happy about. We can't continue to funnel money if it's not going to be managed well, but at the same time, I think we're all here to make sure that the residents of the city of Boston aren't going to lose institutions and services they need. And if these do close, what are we going to do to replace those services? Because we can't just let those go away, especially in Dorchester. It's not close to, right? Brighton isn't as close as other neighborhoods either, but many people use the emergency room and use the, out in the back there, they have their regular healthcare visits from, and we already see, I was at the Lower Mills Civic meeting the other day, and that neighborhood is worried, and I know Brighton is also. If these institutions no longer are hospitals, what's going to happen, which I know is outside of the concern of you, Dr. Ojikuto, but the neighborhood is worried too. Are there going to be condos? Are we going to have like strip malls where we once had, these facilities, healthcare facilities that are so needed? So looking forward to this conversation and hoping to have some actionables when we leave to help support going forward these patients, but also the employers. So thank you.
Thank you, Councillor Murphy. Councillor Ed Flynn.
Thank you, Mr. Chair. It's good to be with you and city administration team also, and my colleagues. It's an important discussion we're having today. Kearney Hospital and the Steward hospitals as well. They played a critical role in our city, in our region. I had the opportunity to work at the Kearney Hospital in Dorchester for many years, part-time. So I know the critical care that they have provided. We were there recently, Mr. Chair, and had a discussion with some of the senior medical team from the county hospital as well. Couple of issues I wanted to highlight that might be helpful is the private medical facilities that manage medical care in our state. That system really doesn't work. It's about profit. It's about making as much money as they can. And the support for patients is secondary, and workers as well. The county hospital, the workforce, many of them are people of color working incredibly hard, supporting patients. You know, that's the issue I also want to discuss too. What happens to these union workers that play a critical role, that make a good wage? What happens to them and their families? What happens to the patients? That's also important. For-profit medical facilities, I had one, Mr. Chair, that wanted to move literally right next to the South Boston Community Health Center. And residents and patients were outraged. And I have to say, and I really don't want to say this, the BPDA actually sent a letter of support for this private medical facility to come to partner with the South Boston Community Health Center. If this happened, it probably would have put the South Boston Health Center at a terrible financial disadvantage. That's something I'm going to continue talking about, because I have a feeling these for-profit medical facilities are coming into the neighborhoods. And if we do have the BPDA supporting that, which they did in this case, it's not a good sign. What's important is we provide patients with the best medical care as we possibly can, especially patients in need, immigrant communities, but also ensuring the workforce is protected. Union workers are also part of the process and should be respected. We should not try to make sacrifices on the backs of working men and women as well. So I'll stop there and just want to say thank you, Mr. Chair.
Thank you, Councilor. Councilor Enrique Pepe.
Hey, good morning, everyone. First of all, I just want to congratulate Councilor Fitzgerald for hosting his first committee hearing. I think it's not a coincidence that it's on such an important topic. And when we talk about the financial uncertainties of Steward Health, it alarms a bell to me, because when I took this role, I understood that public health was a major concern in the city. And we want to make sure that instead of seeing a few hospitals leave our city, to increase the number of support that we can. And, you know, Kearney Hospital, for example, is one that borders my district. A lot of the residents in Mattapan and Hyde Park use Kearney Hospital. And I want to see that continue, because if they lose that resource, who knows how that's going to impact their daily lives, their public health, their mental health. I want to see how we can come into a solution. Thank you to Dr. Bisola Ojikutu for being here. Thank you for the administration for making this a priority. And I just encourage my council colleagues and the administration so that we can work together to find a solution here. But with that, I just want to show that I want to be part of the solution to make sure that we are prioritizing public health in our city.
Thank you, Councilor Pepe. Councilor Sharon Durkin.
Thank you so much. And thank you, Councilor Fitzgerald, for hosting your first hearing. Look forward to many in this esteemed committee. After moving to Boston 10 years ago, I was astounded by the volume and pedigree of medical institutions in our city. Our city is a world-renowned medical destination that attracts patients and doctors from all over the world. Amidst the landscape, it's important that all residents have equitable access to these incredible institutions. And it's extremely dismaying that Steward Health is compromising the basic medical needs due to their financial irresponsibility. I look forward to, to this conversation. It's clear from what I've been reading that there's been a lot of stonewalling. There's been a lot of physicians who have joined the ranks of these institutions and have really, a lot of promise has gone to a lot of people with promise have gone to work at these institutions and have really not been able to see have been able to get to that level. They've hired, private equity is involved with the lack of investment here, extracting a lot of, it's like there's just a lot of issues. They hired a restructuring advisor. This is not my district. I'm just getting to know these issues, but I'm excited about the conversation and really, like Councilor Fitzgerald said, we need to be looking to the future. But we need to also make sure that this doesn't happen anywhere else, and that our systems and structures are in place at the state level to ensure that this doesn't happen again. With 9 hospitals in the state and over 2,000 beds, this couldn't be more of an important conversation in our city. And thank you for convening it. Thank you to the administration for being here. I'll mostly be in listening mode because this isn't my district, and I have a lot to learn about these institutions and these hospitals, but I really appreciate the conversation.
Thank you, Councilor Durkin. Now over to Councilor Tanya Fernandez-Anderson.
Good morning, Chair. Thank you so much. I do apologize that I'm working from a laptop that does not offer a camera, so you'll excuse me. Thank you for allowing me to give my intro. I don't have much to add other than obviously this holds a profound importance in terms of coming together in a hearing to address these critical issues. And I guess, in consideration to other health systems or clinics that are facing similar issues, I propose us looking at a conversation that would proactively look at how we could be preventative in the future. And hopefully this hearing will provide us some crucial opportunity to explore some of those solutions, hopefully to ensure continuity of healthcare services in our communities. And as you know, with the issues with pharmacy deserts and other issues that my district faces, I look forward to adding to this conversation. And again, hopefully that we can look at proactive solutions to resolve this. Thank you so much.
Thank you, Councilor Fernandez-Anderson. Councilor Brian Worrell.
Thank you, Chair, and thank you to the administration for being here today, Dr. Ojikutu and Lou Mandarini. The closure of this hospital, like many of my other colleagues have said, will have an impact on my community that borders closely this hospital. Whether it's the jobs or the medical services that are being provided to the residents of Dorchester and Mattapan, our community will definitely feel the impact. Not only this hospital, but other health services being removed from our community. So just looking forward to the conversation on finding proactive solutions on what's next. So our community is definitely kept up to breast and up to date with the plans of what's going to be done at the site. And that also making sure that the people, whether it's jobs or who go there for medical services, are being connected to new hospitals and that we're finding new jobs for the individuals that are at Kearney. So looking forward to the conversation, and thank you, Chair, for chairing your first hearing.
Thank you very much, Councilor Worrell. I also have 2 letters to read into the record. The first being an absence letter from Councilor Ben Weber. Dear Chair Fitzgerald, please excuse my absence from today's Committee on Public Health, Homelessness and Recovery, hearing on docket number 0191, order for a hearing to discuss the continuity of healthcare services in relation to the financial challenges faced by the Steward Health Care System. This hearing order is of grave importance to me as the Edgar P. Benjamin Healthcare Center in my district faces similar financial challenges and is scheduled to close on July 1st, impacting approximately 76 residents. I ask, if you can, to please read this letter and the following questions into the record in my absence. Is the city aware of the issues at the Edgar P. Benjamin Healthcare Center? Is the city aware of any alternative for patients once the Benjamin Healthcare Center closes? And is the city aware of any alternatives available besides closure of the facility? Please note that my staff will be attending and hearing the hearing, and I will thoroughly review the video, hearing minutes, and public testimony for the Docket. Sincerely, Boston City Councilor Ben Weber, District 6. We also have a letter from the Center for Health Information and Analysis. Dear councilors, thank you for the opportunity to submit written testimony on behalf of the Center for Health Information and Analysis. Established in 2012, CHIA is an independent state agency charged with collecting, analyzing, and objectively reporting data on the Massachusetts healthcare system. As part of its work, CHIA collects and analyzes data on Massachusetts hospitals and health systems through a variety of metrics. In response to the topic of the hearing, CHIA compiled data on hospitals in the Metro Boston region, sourced from hospital cost reports for hospital fiscal year 2022, the most recent full year of data available. To provide insight into hospital capacity and utilization, the below tables include the following metrics: occupancy rate, staffed beds, number of full-time employees, inpatient discharges, outpatient visits, emergency department visits, and average length of stay in days. Also appended are profiles for each hospital included in the table. The profiles provide a comprehensive view of hospital performance with additional information on hospital characteristics, financial performance, payer mix, and utilization. Thank you for your attention to this matter and for the opportunity to provide testimony. CHIA stands ready to serve as a resource to the Boston City Council, so please do not hesitate to contact me with any questions or additional information. Sincerely, Lauren B. Peters, Executive Director of CHIA. I will make sure all other councils, if you guys have not, also receive a copy of this letter. Quickly for myself, I just want to acknowledge that the Kearney Hospital is also in District 3, the district I represent. And I continue to worry about not only the continuity of care and for the residents that it serves, especially those that could be of lower income, but also for the economic impact that it has, be that the tax base, be that the small businesses in the Lower Mills area along Dot Ave that it provides, and the jobs that it provides for those people in the neighborhood. So there are other concerns here, certainly. Not to, and the least of which to mention is, if these hospitals close, where do folks go? Because we know there's a concern. But I'd like to now get into the panel testimony. I would like to now introduce today's panel, which will include Dr. Pizzola Ojikutu, Lou Mandarini, Dr. Alan Sager, and we did invite Commissioner Nicholas Arenello. For folks who know, the commissioner couldn't make it. But what we wanted to know from him was whether Kearney and St. E's were up to date on their taxes, and we have been informed that they are actually up to date on their taxes. And so with that, I thank you all for being here. And if you could please state your name and title for the record. The floor is now yours. We'll start with you, Dr. Ojikutu. Thank you.
Thank you, Chairman Fitzgerald. I am Dr. Bisola Ojikutu, and I'm the Executive Director of the Boston Public Health Commission. So good morning, Chairman Fitzgerald, Councilor Breeden, Councilor Worrell, Council President Louis-Jean, and other city councilors who are in attendance today. And thank you for inviting me to testify before you to discuss Steward Health Care System. As we're all aware, Steward's financial crisis has the potential to impact two important community hospitals in Boston, the Kearney Hospital in Dorchester and St. E's Medical Center in Brighton. In this time of uncertainty, we don't know what the full impact of this crisis will be on these two facilities. However, under any scenario, we will need a collective and coordinated response to ensure continuity of care for patients and to mitigate any negative impacts on our healthcare system in Boston. At the Boston Public Health Commission, our mission is to work in partnership with communities to protect and promote the health and well-being of all Boston residents, especially those impacted by racism and systemic inequities. As developments regarding Steward continue to unfold, our job at BPHC is to be an advocate for the health of Boston residents. We do not manage, regulate, or monitor hospitals. However, together with Mayor Wu and the administration, we will remain focused on Boston residents and ensure that they have access to care with special attention to the needs within the Dorchester and Brighton communities. Both Kearny and St. E's are community hospitals that act as critical anchor institutions for their communities. Their dedicated staff provide emergency, primary care, and specialty care, and they have developed trusted relationships with patients and their communities. Both hospitals also serve a patient mix that is primarily public payer. In other words, care is provided by Mass Health, Medicare, or other government payers, including the health safety net. This means that reimbursements for care are typically lower than what would be paid by private insurance. Public payer patients also tend to be older, sicker, and are lower income than those covered by private insurance. I want to acknowledge that providing care to these patients at both hospitals is a day-to-day challenge, and I express my deep appreciation for the employees of Kearny and St. E's Hospital who have continued to rise to that challenge on a daily basis. We have witnessed the staff's dedication to service firsthand. BPHC recently joined a tour of St. Elizabeth's with labor leaders, and we were impressed by their staff's dedication and their tenures of service, which in some cases span decades. We have also visited Kearny Hospital, and we are in regular contact with hospital president Stan McLaren. At Kearny, we have noted similar dedication among staff and leadership to high-quality patient care and to the engagement of the surrounding community. Both hospitals also have a mission to train future healthcare providers, some of whom eventually end up working in the local surrounding communities. For these reasons, service adjustments at either of these hospitals has the potential for negative impacts to Steward patients, employees, and to the health of Boston residents as a whole. And we are deeply concerned from a health equity perspective. In situations such as these, it is often the underserved who suffer most, because they lack the financial and other resources that would allow them to seek out alternative options for care. No matter what the future holds, BPHC is focused on the health of Boston residents, and that means preserving timely access to emergency care. Last year, Boston EMS, which sits within the Boston Public Health Commission, transported nearly 10,000 patients to Kearny and St. E's. Without these two hospitals, the patient population would shift to other hospitals. This could result in increased transport times for patients and a domino effect on the pre-hospital system, leading to prolonged turnaround times for our ambulances. Our focus is also on ensuring continuity of care for current Steward patients and on mitigating stress on the hospital system throughout Boston. We know that our hospitals are already experiencing capacity issues, which could be exacerbated by system adjustments. I also want to acknowledge the focus on quality of care provided at the two hospitals. The state has taken significant action in recent weeks to establish monitoring programs at Steward hospitals, including both St. E's and Kearny. And I want to thank them for their attention to this issue. Together with the state, our message to Boston residents currently is that you should continue to follow up with your appointments at both hospitals and maintain existing relationships with your healthcare providers. Lastly, I want to emphasize that we stand in full support of the Healy administration's efforts to hold Steward accountable. We join Governor Healy's call for Steward to guarantee safe staffing and supply levels, to commit to ongoing enhanced monitoring, and to disclose the financial documents that they have unlawfully withheld. I want to thank Health and Human Services Secretary Kate Walsh and Department of Public Health Commissioner Dr. Goldstein for their commitment to transparency and collaboration throughout this process. Again, it is important to emphasize that the Boston Public Health Commission does not have regulatory authority over hospitals. Those powers do belong to the state. So to be effective advocates for Boston residents, we need to work alongside our state partners, and we will continue to do so. Internally, we are examining how we can use BPHC's existing resources to support patients in the case of system adjustments. This might include expanding our mayor's health line capacity or deploying community health workers to help navigate patients to care. We are also a convener for the Dorchester and Brighton communities, and we can help bring together community-based organizations, residents, and healthcare leadership to strategize on our collective response. We have already seen Steward's financial issues negatively impact community-based organizations that do important work in Brighton, and we want to guard against further or future developments of that kind. We also provide critical financial support to local health care-oriented community-based organizations and community health centers throughout Boston. In conclusion, we appreciate the City Council's ongoing support and advocacy regarding this issue, and we will applaud your efforts to raise awareness amongst your constituents. Thank you again for inviting me to provide testimony today. I believe that this is just the beginning of what will be an ongoing public discussion as this situation evolves.
Thank you, Dr. Ojikutu. Mr. Mandarini, and please present.
Good morning. Lou Mandarini. I'm a senior advisor for labor policy here in the mayor's office. Thanks for the opportunity to testify this morning. Thank you to Chair Fitzgerald. Congratulations on your maiden voyage here today. President Louis Jean, all the other councilors that are assembled, particularly the ones that we've worked with closely on this. Councilor Braden, I know we've talked about this issue a couple of times. So thanks for the opportunity to come and provide some testimony today, answer questions, listen to comments. So I think we, along with Dr. Ojikutu and other parts of the administration, I mean, we are focused here in the administration on St. E's and Kearney in particular, obviously the two hospitals that are located within the city limits. My comments will largely supplement what Dr. Ojikutu had to say, so therefore I will be briefer and leave more time for questions or comments. So the administration has been working closely for months now with the affected unions that are relevant to the Steward situation. So that's 1199 SEIU, the Massachusetts Nurses Association, and a third union that's a stationary engineer local that does the maintenance work at these hospitals that hasn't made it as into the discussion as the other two, but still an important labor stakeholder. So we have been working closely with these unions and talking multiple times a week about what's going on. While Dr. Ojikutu aptly described the public health consequences of the Steward situation, I will mostly want to talk about the human element of this and you know, the fact that we have an enormous number of affected workers who need to be emphasized in this conversation. In a recent tour we took of St. Elizabeth's, we had occasion to meet, you know, a large number of workers from all different divisions of St. Elizabeth's who have spent most of their entire careers, and I mean, in that case, multiple decades with most of these workers in that hospital. And, you know, they spoke movingly of what that institution means to their patients and to the community. Very little of what these workers had to say was about them or what this situation meant directly for them. That was telling. And I've been in front of a lot of labor people in my life, and the fact that this was all about the neighborhoods and the communities and the patients was a pretty remarkable statement of the kind of workers that you're dealing with here, and frankly, the labor organizations that represent them. I mean, these workers deserve to be protected, and our administration fully intends to continue working with our labor partners across all levels of city government and the relevant quasis, and with the administration of Governor Healy to find solutions to this situation. The largest problem that we have faced for a period of months is the lack of reliable information as to what is actually happening. Every couple of days, there are new rumors of an acquisition or a new operator. Little to none of it is concrete. So it's important to know that the administration fully supports the tough, direct posture taken by Governor Healy in a letter to Stewart on Tuesday that hopefully will finally give us a little bit of clarity about what is happening, providing basic financial information, and, you know, a plan for what comes next in the public forum, and, you know, not talking to this stakeholder or that stakeholder or this counselor or this leader. One conversation about what is actually happening that is concrete, specific, particularized, and direct. That's what we're hoping for. We celebrate the governor's letter, which made it clear that without a bedrock of basic details and information, we can't solve this. So that was welcome. We hope Stewart complies. We thank the governor for her leadership. And with that, I'll leave time for questions and comments for any councilors who have. Thanks.
Thank you, Mr. Arena. Dr. Sebi.
Chair Fitzgerald and honorable members of the committee, Thank you for inviting me. My name is Alan Sager. I'm a professor of health law policy and management, Boston University School of Public Health. I've been tracking 1,200 hospitals in 52 U.S. cities, including Boston, for 90 years. I'm not that old. As you asked, Mr. Chair, I'm going to focus on what can be done and say only a little bit about where we are and how we got here. Certainly, major reporting on Steward and its problems has been going on since May of last year. And its problems, their causes are very serious. State officials and legislators have been visible and audible since the Steward crises became public early in 2024, in the last 2 months. But state officials and legislators are much clearer about what they will not do than they are about what they will do. They won't give Steward public money. They won't identify which Steward services are essential to protect the health of the people. They won't declare a public health emergency and petition a court to put Steward in receivership, allowing the state to take control of Steward. They won't accept responsibility for dozens of years of inaction that have left the state without understanding or the legal tools or the financial tools to identify and move quickly to stabilize needed hospitals. Everyone knew the difficulties going in. The Archdiocese, the 6 Caritas Christi hospitals were not making money. They had unfunded pension liability, capital needs. Cerberus invested $800 million and needed to make a profit on that. How do you squeeze blood from a stone? How do you get that money out of money-losing hospitals? There were promises of high-quality, low-cost care, and everybody knew going in what the payer mix was, what the financial problems were, but those were the promises. Against this background, many people in state government hoped that for-profit health care and competition would save hospitals without state intervention. I like a free market as much as anybody. We don't have a free market anywhere in healthcare. And relying on one is like believing in the tooth fairy. At least little kids have their excuse of not knowing. This mindset allowed Steward and Cerberus and Medical Properties Trust to treat our hospitals like chips in a game of strip poker, stripping away assets and leaving behind unpayable debt. State officials have long been sold the mantra of watchful waiting, that it wasn't necessary to take accountability and prepare to act. So we have financial reports that have to be submitted to CHIA when a hospital proposes to cut a service or like maternity or to shut down. Department of Public Health has to hold a hearing, but there's no action that results, no accountability. The state goes through the motions. So, turning to your question, Mr. Chair, of what can be done. We need knowledge, legal power, and money. They're all within easy reach. Here are 5 steps to take. 1, recognize we have a lot of smart and good people working in healthcare in state government that is and should be accountable. State government should. The administration and legislature could cooperate on developing that vital list of needed hospitals, needed services at those hospitals, what capacity, what location. Also other caregivers like health centers and nursing home problems. Nursing home problems have been a big reason for backup in many hospitals. Third, the legislature could quickly enact a sound receivership law that would spell out when and how responsible officials like the Commissioner of Public Health, the Secretary of Health and Human Services, or the Attorney General could or must petition a court to appoint a receiver to take control of a needed but failing hospital or health center or nursing home or other needed facility to conserve its assets, its clinical care, and put it back on its feet financially. Hospitals have to be recognized, other caregivers have to be recognized as essential sources of protection for our health and safety, as essential community resources, not as chips in a poker game. To complement receivership, the legislature should outlaw new for-profit hospitals, and it should provide for compensating the owners of existing ones for their invested equity. Step 4, we already have enough money. Spending on Massachusetts hospitals this year will be right around $45 billion. Total spending on health care in the Commonwealth, about $125 billion. That's almost $18,000 per citizen of the Commonwealth. We only have to mobilize a tiny share of that money to protect all needed hospitals and other caregivers. The legislature needs to enact a law creating a new hospital stabilization trust fund. It should be financed by the hospitals themselves, by a 0.25% assessment on all hospitals' patient service revenue, plus a 1% assessment on interest, dividends, capital gains, and other unearned income. That will raise $100 million a year from money that's already being spent. Kind of an insurance pool. And many of us remember FHA and VA mortgage insurance that built 50 million homes for Americans after the Second World War. A 0.25% assessment on mortgages. Now, step 5. What if a hospital is in financial trouble, even if it is well managed, even if its costs are reasonable, and even if its quality is good? Then inadequate revenue is to blame. Right now, no payers are accountable for making sure that needed hospitals have the revenue they require to efficiently deliver needed care. And state government doesn't have that responsibility either. The legislature should finance an existing state agency to analyze how much revenue each needed hospital requires to efficiently deliver good and necessary patient care. And that agency should recommend steps that can be taken to boost revenue earned by underfinanced hospitals without increasing total spending. Over the last 5 decades, the state of Maryland has found ways to do this. So can we. And we don't have to wait 50 years. 50 days is enough. Starting in 1995 and continuing for decades, my colleagues and I have drafted bills that would accomplish most of these things. Hearings were held, bills never moved out of committee. So, in conclusion, stepping back, I won't ask for a show of hands, but how many of you know that healthcare spending in the United States each year is 5 times defense spending? 5 times defense spending. Most people turn it around and have it the other way. Health spending in Massachusetts is enough to pay for health care for all. We have the most expensive health care in the world. We spend 2.5 times as much per person as the average rich democracy. They cover everyone, they live longer, and they get more care. So we already have the money to fix Steward and our other health care problems and inequities. We have state government, which has the legal and political and financial opportunity, needs to put its arms around health care problems and embrace remedies with the money available. This is the easiest problem to fix in the United States because it's the only one we spend enough money on already. There are so many good and smart and decent people working in Massachusetts healthcare. State government needs to help them bend their thoughts and energies and budgets toward healthcare's real job, winning affordable, high-quality healthcare for all and stabilizing the doctors and hospitals and health centers and other caregivers that our health depends on. Thank you very much.
Thank you very much, Dr. Sager. I'd also just like to acknowledge at this time that we've been joined by City Councilor at Large Julia Mejia. Councilor Mejia, thank you very much. And thank you to all of our panelists. I'd like to acknowledge the sponsors to begin with, the first round of questions, and then I'll turn the floor over to my colleagues in order of arrival. So folks know, I will open it up to a second round of questions just because this is an intricate process and we've all got a lot to learn on it. So there will be a second chance for questions from my colleagues. But with that, Councilor Liz Braden, if you have any questions, please.
Thank you. Thank you all for your testimony. I think we all know the gravity of the situation. I'm curious about, thank you, Dr. Sager, for your testimony as well. You are saying many things that I agree with. And I think, I really wonder if the powers that be and legislators from across the state appreciate just the gravity of the situation, and I'm sure they don't appreciate that these suggestions that you've laid out are certainly worth looking at and considering. I think the amount of money that we waste in administration and moving paper around in our healthcare system is a ludicrous waste of resources when we have such huge inequities in our healthcare system. So I don't want to editorialize on get on my soapbox here, but how do you think we should go about educating legislators and other stakeholders about the moment that we're in? I think this is a huge crisis, but like in Chinese in the Chinese tradition, you have the symbol for crisis is also the symbol for opportunity. So I feel that we have an opportunity here, but how do we use this opportunity?
One way might be to first mention that when President Kennedy was elected in 1960, we had 140 hospitals in the state. We have about 60 today. So many communities have lost needed care, and many communities that still have care know that their hospital may be a few minutes from bankruptcy. So that's one way of working with legislators. A second to work on that idea. A second would be to identify hospital leadership, especially among the stronger and more financially solid and also more politically powerful hospitals, to wean them away from their belief in doing only what's good for their hospital and recognize, as has been testified here today, that if Steward hospitals close, they're going to be swamped. Mm-hmm. And so that they're all really all playing on the same team. There's very little competition. I think that working with them and enlisting their help and support in persuading legislative leadership to take this seriously and abandon the panacea of the past of watchful waiting. They've waited too long, and they've done very little. It's time to act. And maybe the current crisis, as you say, will be an opportunity to get people to take this seriously.
Thank you. I also want to echo, just a comment more than anything, Mr. Mandarini's comments about the staff, the incredibly dedicated staff at the Carney Hospital and at St. Elizabeth's. I had the honor of doing a tour. I live in the neighbourhood. I know the staff. They live in the neighbourhood. The dedication to service and high quality care, despite the challenges that they're facing right now, is really heartening. And the level of professionalism and dedication to providing the best care they possibly can is very impressive. So I think, we have lots of stakeholders here. The communities obviously want this to be sorted out. The nurses' unions and the other unions are concerned. They want it to be sorted out. The other big healthcare organizations, the other big teaching hospitals and healthcare organizations, they need this to be sorted out, because if this system goes down, there's no way that they can pick up and provide service for 200,000 patients a year. They already have patients on gurneys waiting for hours and maybe days to get a bed coming through the emergency room. So, and the other issue, the loss of the Stoughton Hospital, which is a rehabilitation hospital, that again backs up the beds in the acute care, in the acute hospitals. If a patient can't be discharged in a timely way to a rehabilitation centre, then that blocks a bed for someone coming in. So the system is, it's not just St. Elizabeth's or the Steward Health Care that's in crisis. If we don't address this urgently, we're going to have a much bigger crisis that will affect all of our hospital systems across our whole healthcare infrastructure across the state. So I hope that we can encourage our colleagues at the State House to, really act with some sense of urgency to help address this situation. Thank you. Thank you, Mr. Chair. That's all I have.
Thank you, Councillor Braden. Councillor Brian Worrell.
Thank you, Chair. If you could give me one moment, come back to me. I just have thank you.
Absolutely. Let's move on to Council President Lucy Louijean.
Thank you, Mr. Chair, and thank you to the administration, to Dr. Ojikutu, and to Senior Advisor Lou Mandarini, and to Dr. Sager for your thoughtful commentary. I think it reveals how difficult of a problem it is for us to try to solve, especially at this level. But Dr. Sager, I'm both heartened and disappointed knowing that you've studied for the past 90 years, and yet we still haven't seen the progress that we'd like to see. I loved your call out of how much money we spend on this, and healthcare for all being a solution. As I stated in my opening, I think part of what we need to do here is figure out how we remove the profit incentive from healthcare. It should be about people's healthcare before all else. And I'm wondering if you can talk to the trends that have allowed sort of such a strong profit incentive in healthcare, the private equity. And I ask that because I want to sort of speculate or try to envision if we don't take your sage advice, and if we continue to allow private equity and Wall Street to be involved in decisions about healthcare, what that will look like, and what has allowed those trends, other than probably, there's defense spending is a very big business. Healthcare is because it's a very big business. And then, this is a question that I'm going to have for Dr. Ojikutu as well, but we are city councilors with limited regulatory authority on that bigger problem. So just the two questions. One, what are the trends that you're seeing in healthcare, if unmitigated, will allow these issues to continue? And then second, what are your recommendations specifically for city councilors in a field where state regulation is what really controls in federal regulation? And then I have a question for Dr. Ojikutu, but that's my question for now. Dr. Sager, thank you so much.
Thank you. The main reason we have all this competition and for-profit healthcare is that a bunch of economists and other people promised that competition would contain cost. That's been a joke. And every other rich democracy does contain cost, but they do so by capping how much we spend and covering everybody equally. And so the money has to be spent more carefully. And as Councillor Breeden said, they cut administrative waste. And also, they cut drug prices and theft and other problems that plague us. If we had a free market, competition and profit would be fine. But since we don't have one in healthcare, it isn't worth talking about. So one of the best ways to limit competition and for-profit caregivers is to find other ways to contain cost. And it may be that the federal deficit and other forces will propel cost containment in healthcare, and that will scare hospitals and insurance companies into cleaning up their act and abandoning competition. But that's yet a little ways down the road. I think that on your side, within the city of Boston, certainly as you know, many state representatives and senators, working with them and helping to enlighten them on what might work and what definitely doesn't work would be a useful path forward.
Thank you, Dr. Sager. I appreciate that. And I think that's sort of what my colleagues and I that what we've been trying to do and working alongside our state officials. I think part of the problem too is Cerberus was able to make hundreds of millions of dollars in profit in this sale, and whether or not even in that instance there was sufficient oversight over that sale, I think is an important question for us to ask. Dr. Ojikutu, I think it's more the same question, sort of when you envision BPHC and the role of the city in responding to these crises. How do we do that? Given our regulatory limitations, but understanding as we try to center equity, racial equity in all the work that we do here in the city, and we know that more than 70% of the patients at hospitals, at Steward's hospitals, are either indigent or in some sort of federal assistance, whether that be Medicaid, Medicare. What more can we do? Is it just the partnership with DPH? Are there models, even when it comes to the other healthcare crises that we're facing in the city, working with smaller nonprofits to help build up alternatives? Like what has that look like practically for us to combat some of the profit incentive that we see sort of in the destruction resulting in our neighborhoods?
So thank you, Counselor. I really appreciate that question. I want to emphasize that we are not powerless. We may not have the regulatory authority and we may not, manage hospitals, but there's an immediate role for both the city administration, for BPHC, and for city councilors. Certainly raising awareness, as you're doing now, advocacy are both important, but we also have to think about what I mentioned in my testimony, our budget for EMS. We have to think about how we're getting people from different hospitals to make sure that people are getting there on time. That really does impact outcomes. We need to expand our community health worker workforce because they do an enormous amount of work pre-hospital, so we can actually stop people from getting to the hospital. And we need to strengthen healthcare in other ways by supporting our community health centers. There's an enormous amount of work, and if you compare Boston to other cities, what's happening at our community health centers is oftentimes offloading what happens at hospitals. So keeping that system strong and strengthening it, I think, are really important. There also are healthcare-oriented community-based organizations, making sure that they are stable and solid. They, again, are providing an enormous amount of services that can prevent people from even getting to the point of hospitalization. I think it's also important for all of us to be aware of what's happening, particularly I'm going to spend some time just talking about Dorchester. And when we look at health outcomes in the neighborhood across all the zip codes, we're really talking about a neighborhood that has the highest age-adjusted premature mortality rate in Boston, meaning that's a high rate of death before the age of 65. We also have a very high rate of diabetes hospitalization, as well as a high rate of hypertension hospitalization for cardiometabolic disease. My point in sharing this data is that these are preventable. Okay, so what we need to be doing is really focusing in on building our capacity to help people to prevent the chronic diseases that get out of control and then end up, having folks who are overwhelming the hospital system. These are all things that I believe city councilors, you are already working towards with us in partnership, and we need to continue to do that.
Thank you, Dr. Ojikutu, for laying that out. I think that's incredibly helpful as we as we enter budget season and think about how we support EMS and think about how we strengthen some of our community health centers that I want to see have a larger footprint in our neighborhood. So I really appreciate that. And thank you, Chair, again, for convening everyone.
Thank you, Council President. I'll go back to Councilor Worrell.
Thank you, Chair, and thank you for allowing me that time. Dr. Sager and everyone, thank you for their presentation. Are you able to submit, you gave a 5-point plan. Would love to get that in writing to the committee. I would just like to review it. Although we can't act on that, one thing we could do as city councilors is create resolutions in support of some of the laws or petitions that are up there at the State House. When it comes to the EMS rides, Dr. Ojikutu, you mentioned 10,000 patients are being transported by EMS to the 2 hospitals, Carneys and St. Elizabeth. Has anybody been in communication? What has communication been like to the other healthcare providers in Boston on taking on this, on these new patients and influx into the ER room? Because like Councilor Braden has said, I've been to an ER room recently, and they're overflown. Want to kind of hear like what communication has been already communicated to the other hospital providers.
So thank you, Councilor Worrell. We've been in contact, and it's important for us to have continuous interaction with the other hospital is in our system, and we certainly do that on a regular basis. I think that everyone is very concerned about what Dr. Sager mentioned is the ripple effects if there were to be changes in the system such that we no longer have access to Kearney or St. Louis as emergency care providers, as well as for other services at the hospital. And I think that all of us are very concerned and worried about anybody taking on that number of patients. I think it would overwhelm our hospital system. It would lead to ripple effects, certainly within the city of Boston. And I think that, as I mentioned, the pre-hospital system and the fact that we would not be able to move our ambulances around the city as quickly, I think is very important. I do think that it's also critical for us to just think about, how far Kearney and St. E's are to other hospitals as we think about our overall system, not just what's happening at Kearney or what's happening at St. E's. So for Kearney, the nearest facility that has an emergency room is Boston Medical Center. That's over 4 miles away, and we all know Boston traffic. It could be 15 to 20 minutes, depending on, how traffic is going or what time of the day you're talking about. The other closest hospital is outside of Boston, which is Milton Hospital, and that's just under a mile away, so it's 7 minutes. It does take people outside of Boston City. For St. E's, Mount Auburn Hospital in Cambridge is 2 miles away, and probably, I would say 12 minutes to 15 minutes, depending on how long it takes to get there in traffic. And then you also have your hospitals that are in the Longwood area. So there are hospitals there, but there is a critical time delay that in getting people from place to place. And I think we have to think about all that. We think about the patients that we're trying to manage, those folks who are underserved, those folks who are disabled, those folks who are elderly, who have trouble getting around, and think about how critical it is to have resources in close proximity. So I think both of those two things, both the fact that other hospitals, are already at capacity, and the fact that it will be a challenge for people to get to other places, or for us to, use our ambulances to get to other places. These are two things that we need to continue to consider, think about, and advocate, against, that being the ultimate outcome of this.
Thank you, Dr. Ojikutu. And just kind of follow up on that question, what support or resources is the administration prepared to offer to facilitate in the transition of Steward hospitals to new operators should it become necessary?
Is that question for me, Councilor Worrell?
Or to the panel, I'm not sure if anyone could take that, either to you or Lou.
Councilor, can you just say it one more time?
Should Steward no longer operate, what resources or support would the administration prepared to offer to facilitate in the transition of the building to new operators? to the actual site?
Well, I mean, I don't mean to be cagey or not answer the question, but I mean, we don't know whether that's happening yet. We don't know what's happening yet. So, I mean, the question of what we can commit or it's not a discussion that we've had or reached any conclusions. What I can say we've done is look at the zoning and have had conversations with the BPDA with respect to both properties, and are in touch with the fact that whomever the owner is going to have to come to the city and be responsive to the planning process and use of the property. So we fully intend to use that leverage and that authority we have. But with respect to your larger question, we don't have any concrete decisions on that yet.
Thank you to the panelists, and thank you, Chair. No further questions.
Thank you, Council Burrell. Councilor Erin Murphy, floor is yours.
Thank you. And thank you for uplifting the concern about the EMS time and travel. I know that their union leadership has signed on. I sent them the email to make sure, because they're going to be public testimony to just speak directly of their concerns about their, EMS times. But one thing, and I know, Dr. Ojikuta, you've been following the concerns probably for years, not just the last couple months at the Kearney St. Elizabeth's, and there's specific services, right, medical services that they're known for. I know there's mental health beds at Kearney. Many people go to the ER at St. Elizabeth's. Like I mentioned, I myself, OBGYN services. There's also recovery services. They have good service. So are you already trying to prepare for those specific? I know overall, and you shared what I assume would be true, that we're going to have to deal with it if they do shut down, but I'm assuming you're already kind of putting things in place already, maybe especially for these specific needs. And the other, when I visited the last time at the Kearney, and they've said it before, that we know that many of our downtown hospitals are overflowing, and many times patients are waiting in hallways, but the Kearney doesn't always get that overflow, right? And many times people maybe ask the ambulance to not bring them there, or if they're having surgery. So not sure if you can touch on that also, because they were saying that they would be always willing to take any overflow, but you see that downtown hospitals are at their max at this time where Kearney may not be. So how do we funnel patients knowing that there is good care at the Kearney? If there's anything we can do to support that.
Thank you, Counselor. So in terms of planning, what I would say is that we have been talking to the state and thinking about the services that are provided and thinking ahead to what may or may not happen. As Lou mentioned, we just don't have line of sight on that right now. But we do know, as you stated, that there are certain services that people do rely and depend on at both St. E's and at Kearney. And the state has thought through where people can sort of access those services. They have been thinking about that. We will continue to think about that with them, but keeping in mind that our desire is to keep healthcare services, where they are and to optimize them. As you mentioned, oftentimes what we see is that we don't really have a coordinated system where patients are transferred, from one place to another if there are open beds. I have talked to the leadership, particularly at Kearney, because you mentioned, Kearney specifically. And what he shared and what I agree with is that more partnership, more systems-oriented thinking, as opposed to thinking about one hospital's, sort of metrics, thinking about overall systems care that would improve access within the city of Boston. I think more of that needs to occur. So I would say ongoing advocacy, which is what you're already doing, is really critical, and we will continue to do the same.
I do, thank you for that. I do want to just end on giving a shout out to Tufts. And I know that we're here talking about our concerns, and thank you, Dr. Sager, for kind of calmly explaining the crisis we're in, but at the same time, we are probably the best city in the world for healthcare. People come all over the world to get care here. At the same time, we know we're trying to make it even better, of course, but you never really think about it until you need it, right? And I needed to make a personal visit to the ER, and I went to the Tufts ER, in and out, and it was a wonderful experience. So, you know, it's not always that patients are not having wonderful experiences at our hospitals, and we're saving lives and doing great things. But at the same time, I know we're here to discuss the possibility of our hospitals closing, and obviously we can do better, and healthcare for all would be an amazing thing. But just wanted to shout that out, that, and you know that, Dr. Ojukutu, that people are always giving so much and helping so many, but it's important that we're uplifting the, and one last thing I will say, obviously most people think first about like the nurses and the doctors, but I know there's probably, and Lou, you know this, but there's unions probably listening in on this, but it's also, you know, the SEIUs, it's the, you know, the facilities, the people who work in the parking garages and the cafeteria, and the ones who check you in at registration, and all of the, you know, aides around the hospital that also make it a wonderful place. And I know at Kearney, it's a family, no matter what level you're working at, that they're really close, and that makes you feel comfortable as a patient when you go in there. So I did just want to end with that, but thank you.
Thank you, Councilor Murphy. Councilor Ed Flynn, you now have the floor.
Thank you, Mr. Chair. Again, thank you to the panel. Dr. Ojukutu, thank you as well. And I'm glad you highlighted the time for EMS to transport patients to hospitals. Are we seeing a longer ride now for EMS to get patients from their home to various hospitals across the city? Are those times going up?
So I appreciate the question, Councillor Flynn. I don't have that in front of me in terms of overtime. I think this is an ongoing concern, and I can certainly get the most updated information to you after this hearing.
That would be important. That's also part of this conversation as we go into the budget season. It's important for city councilors to advocate for EMS. They play a critical role. They do an outstanding job. I don't think we have enough of them. I think we all agree on that. But I also know that the response time getting a patient to a hospital is going up. I have talked to many people, and they are concerned about that and the impact it's having on patients in hospitals as well. Any other further information you might have on that, Dr. Ojukutu?
So I just wanted to mention, like I said, I don't have the actual response times and to give you the exact information, but what I do know is that Boston EMS, as you are well aware, has experienced record increases in calls to 911 since 2020. And we also know that they went from answering the call for more than 100,000, so 115,000 emergency medical incidents in 2020 to 138,000 incidents in 2023. So that was a 20% increase. So clearly there has been an increase in the need for EMS, in the need for services around our city. And certainly I would appreciate, I'm sure Chief Hooley would echo this during budget season, if we think about, supporting, continuing to support, as you already have and the City Council has, supporting EMS as we look at our budgets.
Thank you, Dr. Ojukutu. I know Dr. Sager, you have your hand up.
Yes, Councillor Flynn, thank you. First, just to wrap up a few items, Councillor Worrell, I'd be happy to provide the written testimony that spells out the 5 steps, and also legislation that's been introduced in both the House and the Senate over the last 30 years to address 5 points. I'd also like to speak to Councillor Murphy's point about St. Margaret's and St. E's and other changes, and also Tufts. Hospitals are not interchangeable parts in some healthcare machine. Just as the workers at hospitals, nurses and others, do a terrific job, patients weave networks of care, friendly faces, places where we're comfortable. And when these are disrupted by a closing, owing to Steward Cerberus, MPT, recklessness, and other behaviors, that's a mess. And that's one of the reasons it's so important for the state to get its arms around these problems with a receivership law, with hospital stabilization, trust fund, so that every needed hospital is protected, and health centers. Thank you, Councillor Flynn.
Thank you, Dr. Sega. Mr. Chair, may I continue?
Please.
Okay, thank you, Mr. Chair. One of the things I was concerned with also is the for-profit medical companies that are coming into the city trying to partner with our community health centers. It almost happened in my neighborhood with the support of the BPDA. I had to advocate against that. BPDA thought it would be a good partnership to have a for-profit medical facility partner with the South Boston Community Health Center. So I was discouraged by that, but I just want to let my city council colleagues know that it could be happening in their neighborhood as well. So Lou, just wanted to ask, is that something that we're going to continue to see? Is, you know, as you know, I was discouraged to see BPDA partnering with a for-profit medical facility, supporting a for-profit medical facility, partnering with the community health center. That was the BPDA position, but I don't think that's a recipe for success in this market. But are we going to continue to see the BPDA supporting that type of partnership?
Councilor, I can't necessarily comment on what is to come, but what I can certainly do is communicate your concern about it to the BPDA, and I'll be glad to do that.
Okay. Yeah, just to be clear, is when this for-profit medical facility tried to seek ZBA approval to come into South Boston, they said that they wanted to partner with the South Boston Community Health Center, and the BPDA sent in a letter of support for that type of partnership. My point is that type of partnership would devastate a community health center. Dr. Ojakuto, I see you.
Yeah. Thank you, Councillor Flynn, for bringing this up. Like Lou, I can't speak to anything that occurred, with BPDA, but I did speak to the president and CEO of South Boston Community Health Center, and he expressed a number of concerns similar to what you stated. As you know, the Boston Public Health Commission does support our community health center network. It's a very strong network in the city of Boston. We are very lucky to have the strength of that particular health service. For this urgent care center, the proposed location was, a block essentially from the community health center. And I think anytime something like that occurs, we just want to be careful and look at what services are provided there versus what services would be provided or have been provided at the community health center. And think about what the real gap is and what the real needs are for the community, and put community first. And so that's what we're doing. And we have been thinking about this with South Boston Community Health Center, and we'll be visiting very soon. So we'll be in touch about this particular issue.
Yeah, Dr. Ojakutu, thank you for that response. It was helpful. I know the importance of the South Boston Community Health Center. They play a critical role in our neighborhood. especially in our public housing developments, communities of color, our seniors, persons with disabilities. Community health centers are part of the solution. They're not part of the problem. We need to support them. There's some stuff the city council can have a major impact on, and that's supporting our community health centers. And I'm not going to spend my time trying to hurt them. And I am very disappointed at the BPDA for that letter of support for that potential partnership. And I just want to let my colleagues know that that type of partnership would be devastating to a community health center. Thank you, Mr. Chair, for giving me an extra minute.
Yep. Thank you, Council Flynn. I also do want to remind others that just in the interest of time, there will be a second round of questioning. I hope we can get most of it out in this first round. And we still have another panel to go. So, and I know, Dr. Sega, I don't know if you have to leave at some point, but I know that there are others. I know I have questions for you and I'm last on the list. So hopefully you can stick around for a little bit, but if you have to leave, please just raise your hand again, let us know. Councilor Enrique Pepin, you're up next.
Hey, Counselor. One of my questions was already asked and answered, so I would like to give my time to another counselor.
Great, much appreciated. Thank you, Councilor Pepin. Councilor Durkin, floor is yours.
I don't think she's here
No
anymore.
longer on. All right. Councilor Tanya Fernandez-Anderson, the floor is yours.
I don't think she's here.
Thank you, Chair. Thank you, Chair Fitzgerald. I wanted to just ask from the administration. Well, first, I wanted to second what Councilor Rell said about resolutions in support of, or going on record in support of a position. And I think that with the doctor's statement and the work that's been filed, the bills that's been filed in the state and Senate, looking at that and seeing how we can voice our position through a resolution would be a good idea. So looking forward to that information when the doctor is able to submit them. And as well as to the administration, are there any particular policy initiatives or financial supports that the city is considering in terms of bolstering the resilience of Boston healthcare system amidst all of these challenges? I mean, as I mentioned, with the Walgreens closure and all of these other health inequities and disparities in Boston, are we proactively looking at policy initiatives or financial supports?
Councilor, do you know who you're directing that question towards?
Yes, I stated to the administration.
So, Counselor,
Lou? I think it would be Lou.
Right, that's what I was going to do, is ask if Lou could speak.
Thank you.
Well, Counselor, I mean, I think I don't mean to sound like a broken record on not knowing what's coming, but I mean, I would say we have not given up on making sure or doing everything we can to make these hospitals continue to operate. So, I mean, the question of sort of moving forward to what comes next isn't a subject we've broached. I mean, our conversations with the gubernatorial administration, with the relevant agencies and the unions and all that have focused on what we can do to keep these institutions anchoring the neighborhoods they're in and serving the community. So we haven't moved to that question yet with respect to either Kearney or St.
Thank you. Not having an answer is okay. And I guess, this is an opportunity. This is the opportunity, hopefully, that we think of proactive ways of beginning a conversation. Looking forward to that if the council can be of assistance. In terms of working together or figuring out next steps or how we're communicating to the public with these closures and understanding that, the different levels of impacts or intersectionality with nursing homes and pharmacies and clinics now closing. How are we communicating this to the public? And I think, Dr. Jakutu, if you could offer anything at all in terms of efforts and initiatives to get this information out to the public.
Thank you, Counselor. So I think that what's happening now is that we are in a period where we don't know what's actually happening. That's because there's been a lack of transparency. It's not clear what changes will occur in terms of Kearney or St. E's. As we know more, and there is really a definitive action that will occur, then we will certainly disseminate information as we do, which is, either through, communications through like a press release or through our MIC. We are in constant communication with community partners, and, that's sort of our role. But I think the challenge here in terms of disseminating information is that there hasn't been clarity around information. We were all sort of hearing things in the media, and we're all speculating, and we're doing our best to piece things together. But that's really the challenge. I mean, we want to be a trusted source of information, so we really want to find out what's definitively happening. And as I mentioned before, sort of prepare alongside our state partners, with a plan, and what is it that we can do to hopefully get people to other places to receive care so that nobody falls out of care. And again, thinking about how we transport people and how we could enhance our mayor's helpline and so on and so forth. So that's currently what we're doing.
I can appreciate the one, interest in being transparent, two, but also being a reliable source, not giving out information that is inaccurate, but also looking at proactively working with the state and other stakeholders to figure this out before disseminating information. So thank you. In thinking about all of what's happening in terms of around health, you can see how our constituents are concerned about the future of already a burdensome healthcare system, and questioning whether or not they'd have access, or whether or not that those responsible are being transparent with delivering information ahead of time, or with at least with ample time for them to prepare and coordinate how they're accessing their healthcare. So I guess would it make sense if we were to preemptively look at maps and understanding by population, what our healthcare systems or pharmacies and nursing home access looks like? Is that a study that we can actually map out and say, in these catchment areas, we know that these couple hundred people or whatever have access, and is it adequate, and is it a desert, or what's happening with the state of healthcare access in Boston?
Absolutely, and we've been working on that process. We have a report that we would like to issue in March that will include access around the city to pharmacies, to community health centers, to other urgent care sites, to hospitals, in addition to transportation routes and where we see that there may be a concern in the future, say if there is a closure of any of those that I named, and where we should preemptively be thinking about how we establish new services, bring in mobile services. So we do have a report that we are working on. And again, my hope is that in March, we will be able to post that report and provide you and everyone else with an update.
Thank you so much. There has to be a way of quantifying need to, financial planning. Like, how do we know, like, what we need in order to address certain harms that we know we can not predict, but, looking at this study and figuring out where the need is and understanding our future budgets, I think is important for us to communicate that as well. I really appreciate that you're always a step ahead of us on this, and looking forward to looking at that study. Mr. Chair, thank you so much, and Lou, Dr. Jakutu, and Dr. Sager, thank you so much for being here.
Thank you, Councilor. Councilor Julie Mejia, floor is yours.
Thank you, Chair Fitz, and congratulations.
Thank
Your maiden hearing, right? This is the first of
It
many.
is.
Well, I'm going to keep it simple because I know you are on. We're going to keep it simple. So thank you all to the panel. I'm just really, I've been listening here, and I just have a few questions. I'm always really concerned about the process. I believe the process, how we get somewhere, is just as equally as important as the outcome and where we get to. And so I would love to hear any communications in terms of community engagement, what information has been shared, how are we communicating to the general public about what's happening in and around this, because I think that there's a lack of engagement or at least information, because some of the folks that have been reaching out to me are confused. And so I'm just curious, what role, if any, can we play, the administration play, in terms of like helping people understand what's at hand? So that's one question I have, and just in terms of the engagement piece. And then I'm looking at the bigger picture here. I am a community health center baby, if you will. I go to a community health center. My mom goes to a community health center. My daughter goes to a community health center. But we also have a hospital that we're attached to. And so that level of care, when we're thinking about the bigger picture, I'm curious about how are we preparing our community health centers so that we're not overburdening them now, if and when the situation manifests in a way that is not going to be favorable, if these two hospitals do leave, kind of what the game plan is there and how we're going to sustain, right? And then, this is a trend across the country. We started seeing in 2005, it was first the rural hospitals, like over 100 and something hospitals across the country were closing. And now we're seeing this trend here in urban cities. So I'm just curious from a perspective of like what the writing is on the wall. What can we learn from other cities and states that have experienced closures, and what lessons are we taking from that playbook and helping to set people up for success? And then lastly is the accountability piece, right? I know that recently our governor has filed to secure financial records, and really when we're thinking about getting ahead of something, it's also important to understand how we got here. So I'm curious what, if any, information you are able to share about the financial situation that we find ourselves in, and what role, if any, the city can play to fill in those financial gaps. 3 questions.
So, Councilor Mejia, I can take number 1 first. You mentioned the need for community engagement and community awareness and information dissemination. I think that the challenge in this circumstance is that there's been a lack of information. There's been, rumor, and there's been what has shown up in the media, and that's fine. I think it's important, but we would like to be more of a definitive source of information, and it hasn't been clear what that information should be that we're transmitting to people, except what I mentioned during my testimony, that for right now, people must continue to maintain their healthcare appointments, because that's for their own health. They must continue to go to Kearney, to go to St. E's, to follow up on their care. Do not assume that care will not be provided. There is care that's being provided. Some of the city councilors were just recently at visits at both St. E's and Kearney's. Their staff were working diligently to provide excellent quality care for patients. They need to continue to do that. So as we know more, I think we'll be better prepared to hold some community engagement meetings. We do that a lot, as you know. We're also, we can prepare to put out some statements. It's just that there has been a lack of information. We fully support Governor Healy's attempt to get more information, and we'll sort of wait until, I guess the deadline is tomorrow, when they will know more. And then we will look towards what our communication strategy would be, and love to work with you and the other city councilors on that.
Yeah, so I'd like to offer that as, our office is happy to help support, because I think communication dissemination is key, and also who are the messengers in that process, right? So we'd love to sit with you and figure out how we can be supportive in that space. So thank you for that.
Absolutely.
Is there anyone on the panel that could handle Council Mejia's second and third question, knowing that we are limited on time here at the moment, so at least a brief answer? And Council Mejia, I don't know if you want to reiterate the questions quickly?
So I'm really, I'd love to hear a little bit about the trends and what we have been able to learn from other cities and states that have undergone this process, and what are lessons that we can learn. And then the other is really about the financials. And I mean, I know we don't know all of that, but I'm curious about how we ended up here. And if anyone could provide some input on that. And well, actually, now that you asked, and the economic impact that this is going to have on our residents. I mean, we have to also think about the workforce and how we're preparing for that.
Mm-hmm.
I'm not sure anyone on the panel has these answers yet, right? We don't know what the fallout could be. But Lou, on the workforce side, right, Mr. Mandarini, it's if these hospitals close, there's an impact both to the workforce that exists in that hospital as well as to the community around the hospital that sustains off of the patients and workers in that hospital. But I don't know if we have anything that we could quantify. Dr. Sager, I see that you have raised your hand, so please, if you have anything to add.
Thank you, Mr. Chair. One piece of information that may be useful is that in the state of Maryland, they saw big financial stress to some hospitals, especially in Baltimore, that had served larger numbers of uninsured people. And they developed over time a state law that requires the state commission to set budgets for each hospital that are adequate to safely deliver high-quality patient care. And all payers pay the same price, so hospitals are not disadvantaged or discriminated against for serving Medicaid patients, for example. And they have a federal waiver that allows them to do this. Massachusetts experimented with something like that under Chapter 372 some decades ago in the 1980s, but we did it very quickly and very badly. Maryland has made it work for 50 years, and as a result, they don't have Steward-type problems.
Thank you, Doctor.
I just want to, and I do appreciate Chair Fitzgerald naming the fact that there's still things that are unanswered. I feel like there is a trend here, and it seems like there is an attack on low-income people, and particularly people of color who are the most vulnerable. And I think that there's an opportunity for us to be strong advocates in standing up, and especially in the healthcare space. I feel like there's hospital gentrification happening here. And I think, to my colleague's point in regards to what's happening with the pharmacies, now with the hospitals, I think now more than ever, we're going to need to be loud advocates in the space. And I look forward to working alongside you all to do just that. Thank you.
Thank you, Councilor Mejia. Some quick questions of my own, and I do want just more. This is just to get it out there and on the record, but I'd love to have just a quick feedback from anyone. Originally, I want to lay out the options for what actually can happen in the next step when I think of the Connie specifically, but as well as St. Elizabeth's. And I've been talking to some folks, and I think I have a list. I just want to know if I have a complete list of what future options are. None of them, each with their pros and cons. But tell me if there is anything I'm missing. And I guess this would be for Dr. Sager and Dr. Ojikutu specifically. We know that Steward could find financing, right? That's one option. Steward files bankruptcy, which then takes a lot of the state teeth out of it because it goes to a court-appointed trustee to figure out who gets paid what. There could be a medical village, it could become, right? Where we have a lot of practices come in, almost like a mall of medical services. And again, I'm throwing everything out there, right? I just want to know what our options are going forward. Could we make it a large community health center, right? And the final option is a new hospital completely in and out together. And Lou, I have a question for you on maybe what that would take, or Dr. Sager. But is there anything I'm missing in there of what this could become, right? Continuation of Steward bankrupt, a medical village, a community health center, create a brand new hospital, Phoenix from the ashes type stuff that does healthcare right. And like Councilor Braden said, find this sort of opportunity in the crisis. Is there anything I'm missing, folks?
Mr. Chair, as one foundation for possible remedies, it would be good to know what the needs are. And that's something state government has refused to do, to list where are the people, who's at risk of underservice if Steward goes belly up, and what can be done to prevent that from happening. I've seen talk about Medical Village when a hospital in Northeast Washington closed. They promised a medical village. And I know you don't mean this, but down in Washington, it proved to be a smokescreen behind which they could close services. You know, it said, well, you don't need a hospital, you just need outpatient care. And it turns out that they may end up with nothing. So it was kind of a bait and switch in that instance.
No, it's appreciated. Again, I want to know what the pros and cons are of these options, and if this list is the complete exhaustive list of options we have. Of course, I did not list state receivership in there, but from my understanding of the governor's recent statements, I don't know if that is really an option, but I guess we should leave it on there.
Counselor, if I may, one of the things that obviously I think a lot of people have looked to, and certainly it's something that the unions have emphasized in the conversations that I've had with them, is another operator. I don't know if that's fairly assumed by your question of Steward continues, that option on your list, but I mean, that certainly is one that a lot of people are talking about. Another operator takes one or more of these hospitals.
Right.
So.
Nope, that is another option, right? That is sort of a preferred option. In the easiest transfer, right? If someone were to take it, we know that nobody wanted them in 2010 when Caritas was putting these up, and so I wonder what the appetite is going forward, as well as some of the state hurdles in terms of monopolizing hospitals and things like that would have to clear. But again, I'd prefer trying to go over those hurdles than to lose a hospital, especially in Dorchester.
As a means of doing that, it might be helpful to try to abrogate the rents that are due, because those heavy rents on the sale and leaseback are a huge financial burden on the Steward hospitals and would be a big impediment to another operator coming in, unless legal action could be taken to either cancel the rents or recover the money from those who have it.
Understood. Thank you, Doctor. Mr. Marini, in any conversations with the state that you've had, that you may or may not know this answer, if Steward does not release their financials by Friday, do we know what the state's options are or teeth to use there?
I do not, but that is certainly something that we can get an answer to you about. I've got a couple of check-ins today, and we'll be glad to seasonably report back to you with whatever we find out, since today is the deadline that the governor imposed.
Yeah, and that was just educational purposes. I was unaware of what could the possible steps be. What is the process if hypothetically someone wants to buy and retain ownership of the Carney or St. Elizabeth's? Or the network of hospitals as whole. How long does that process take? I know it's at the state level and probably has to go through a number of processes, but maybe Dr. Sager, if we had someone to say, hey, we're willing to come in and we're interested in overtaking Carney, St. Elizabeth's or all of the ones in the state, what typically is the timeline of that process? Just so we have an understanding of what our deadlines are.
It can take a long time. The change in ownership would probably require a determination of need going through the Department of Public Health. And I think there may be periods where notice has to be given. Emergency state legislation could override that. Or the Commissioner of Public Health might declare a public health emergency. That might allow the state greater flexibility and ability to move a lot faster. Governor Dukakis did that when a nursing home closed suddenly decades ago without preparation to transfer patients. And under those circumstances, patients die. And so that was the foundation for the public health emergency. And I think similar circumstances are at play here, because owing to the ambulance disruption and the lack of adequate capacity elsewhere, the loss of Steward hospitals could be a catastrophe.
No, agreed, and that sort of led me to my next one. Just for like, in our visit to the Carney, they said 80 to 100 people visit the emergency department every day. And you think about that, extrapolate that over the course of a year, and where do those people go on our already overburdened hospitals? And folks have mentioned that, and I think that is something that the larger audience understands and can consume. But it's a scary thought to think where people might go. One thing I would ask the panel to do, especially when they're talking to the other major hospitals, the potential hospitals that could acquire the Steward hospitals, is in talking to the county, it's not to poach the doctors and nurses yet. And so I hope that the administration went out there just to talk about when they see there's a hospital in distress and there could be some nurses and doctors looking to jump ship, that they don't necessarily proactively try and go after them, because if they take the good doctors and nurses from the Carney, from St. E, say, hey guys, come with us, then there is no hospital to save, right? And so, Dr. Sager, I see you nodding your head, but right, am I right in trying? I want to advocate for that more, and I hope all my colleagues can advocate that for whenever they speak to any of the larger medical institutions, to just give us some time to try and figure this out at the moment, before you try and take the best doctors and nurses away from our hospitals.
Vitally important. And often the best doctors and nurses are the ones who have more opportunities elsewhere. And so it's numbers, but it's also losing veteran, experienced, essential people. And one of the keys there is a guarantee that the place is going to stay open. Makes people much less likely to feel pushed into a lifeboat.
Yes, I appreciate that. Mr. Mandarini, you have your hand up?
Yes, Mr. Chair, I just wanted to, I had made note at the beginning of the questions in Councilor Weber's letter with respect to the Edgar Benjamin Nursing Home in Mission Hill.
Yeah, please.
So we have got the relevant cabinet chiefs and department heads working on that. We're getting our arms around exactly what's going on. And we'll have proper conversations with the state authorities that oversee that. I just wanted to put in the record that we will be glad to update any councilors who have concerns with respect to what's going on there beyond Councilor Weber. And we can do that and follow up after this hearing.
Thank you very much, Mr. Mayor. We appreciate that. That concludes my questioning. I hesitate to do this, but I did say there would be a second round, but I would ask my colleagues if it is only a clarifying question or of utmost importance that you want to know, just in the interest of time and for our folks on the panel here. But if there's anyone, if they would just raise your hand if you have a question. I see Councilor Worrell.
Yeah, thank you, Chair. I just have two quick questions. I don't think I heard a timeline on, and I know a lot of this does have to do with the state, on if there was a change of ownership, if we could get this like an estimated timeline. And then also, this is for Dr. Ojikutu, knowing EMS and scaling up is, one of our solutions. Can you talk about any challenges with current staffing? Is it lack of people applying for the positions, lack of funding for positions? Like, do we need to increase the available positions? Can you just talk about the challenges you have with staffing for EMS?
Does someone want to take the first question, and then I can talk about EMS?
Sure.
Yeah, I'm glad to take it. Councilor, with respect to timeline, and I'm actually annoying myself by saying we don't have reliable information at this point, but I am going to say it again. And we will amend, whatever we find out that's reliable. We're glad to update, the individual councils on what's happening. But absent anything concrete or detailed or real, it's impossible to answer the question about timelines.
Thank you.
So right, for the second question in regards to EMS, I think city councilors are aware that staffing has been a concern. The new cadet program has increased our EMS personnel, and EMS is certainly, we are looking for new FTEs. We want to increase the number of personnel that we have available, and also increase the diversity amongst our personnel. So it is a concern. It is something that we're working on. We are, obviously looking at, the number of ambulances we have out there, as well as thinking about our infrastructure for EMS. So it's certainly something that's going to come up during the budget hearings. And I know there have been some ongoing discussions and back and forth in regards to the data. So we should all be, prepared to have a deeper discussion as we get to those hearings.
Thank you, Chair.
Thank you. I do have one final. Stewart sent a letter this morning. I don't know if anyone on the panel has had a chance to review it yet in response to the governor's letter. If not, I will make sure that the panel also sees it if it's not in their inbox when they get off of this. I wonder, we were supposed to have the Kearney president and St. Elizabeth's president on the next panel. But they both, we found out this morning, could not attend. And that's not to say anything about those individuals specifically, especially I know President McLaren over at the Kearney Hospital, local guy, cares very deeply about what they're doing. And same with, I believe, Dr. Paul Smith over at St. Elizabeth's. And they're doing good work in trying to provide these services. It is my strong assumption that they were asked not to attend, probably by their higher executives, which is an unfortunate move by Stewart. And if you also read their letter, they seem to promote that they're being cooperative, but I think that their PR is not the best at the moment, and by not having their representatives allowed to speak today, I only think it further damages their reputation. But with that said, Dr. Ochukutu, thank you for your forward thinking on what we can do as a city to prepare for whatever may come out of this crisis. We really appreciate that, and any future burden the city will carry, that we will be prepared for it. Mr. Mandarini, thank you always for your help, especially with the workers in this space as well. And Dr. Sega, thank you for the encouragement that this is actually a solvable issue, right? And that we say the money is there, and it's just how we use it. I think that's the only sort of silver lining we can take out of this, is that hopefully that you are correct. In that this is an issue that should be very solvable, and we can look elsewhere to see how it was done. So if there are no further questions, I'd like to thank the panel. Thank you very much for coming, and we really appreciate your time.
Great.
Thank you.
Thank you all. Thank you.
So in the essence of time, we will continue to move on here. We have another panel of the workers and employees, specifically from SEIU 1199 and the Mass Nurses Association. On this upcoming panel, we have Carrie Medina, Jesse Burns, Maureen Raitt, Ada Heliage, Ellen McInnes, and Lainey Marr. And I'd like to have them introduce in that order, if they can, and I will help that out. But just a quick presentation, and I would ask the folks on this panel from SEIU and M&A to please keep your comments to about 2 minutes, and then we will open it up to questions again from my colleagues. Ms. Carrie Medina, you have the floor.
Hi, thank you, everyone. Good morning. I'm the Vice President of 1199 SEIU Steward team. I represent 5,200 members across the state along with my team. 400 of those members belong to Kearney and 900 are from St. Elizabeth's. Most of these facilities are in gateway cities where our most vulnerable patients live and seek care. Good Samaritan is within my community. I know we're not talking about them today, but they are within the Steward Health Care System. And we utilize the Steward Health Care System in my family. My focus and our union's focus has been and will continue to be ensuring that patients feel safe and are receiving adequate critical care, and that communities know that they can receive quality health care. Protecting our good union jobs is of the utmost importance to me, my team, and our organization, and keeping our union strong. We want to ensure that we continue to hold a seat at the table with the next steps. And we do see the value of being able to attend and support these hearings, delegation walkthroughs, and that we're participating in them so that you can experience what our healthcare workers face on a day-to-day basis. Providing the utmost quality care is all our workers want to do, and they want to know that their hospital is going to be there. Our members are patients too. They seek their treatment within the system. And we know that Steward is going to look very different in the near future, but we must together work to ensure that it's a smooth transition. I'm very proud to be the vice president of this Steward team and of our membership, and work and continuing to work to continue to perform the difficult challenges that our membership is going to face. So thank you for your time.
Thank you very much, Ms. Medina. Jesse Burns? Available? If not, I do see Ms. McGinnis here, so we will jump down to Ms. McGinnis unless there's nobody else promoted up. Ms. McGinnis, you have the floor.
Thank you, Counselor. Good morning, counselors. My name's Ellen McInnes. I'm a nurse at St. Elizabeth's Medical Center. I also sit on the Massachusetts Nurses Association Board of Directors. I've been a nurse at St. Elizabeth's for over 25 years, which makes me in some circles sort of a newbie, considering the age of a lot of the folks who work at St. Elizabeth's and Connie. I know that St. Elizabeth's is a vital source for our city, and we couldn't possibly suffer the blow of losing what St. Elizabeth's brings to our community. We care for some of the most vulnerable and marginalized patients in the Commonwealth, for that matter, because we're a tertiary care facility, so we receive patients from all over the Commonwealth. It's important to recall where we were 14 years ago when Caritas was on the verge of bankruptcy. Nobody else stepped up. Nobody in the Commonwealth, nobody across the country stepped up, and Steward did. For all their faults, for all the issues I have with Steward, it needs to be said that they stepped up. They assumed the 4 Caritas Christi hospitals, eventually expanded, and virtually all of our hospitals are serve communities of color, communities of need. And we want to continue doing that. When other people were reluctant to assume responsibility for these folks who needed this care, we don't want to stop doing this job. And I think it's time we get past, the bad behavior of Steward and recognize that those of us who work at Steward hospitals and take care of our patients do so not because of, but in spite of Steward shenanigans and all the foolishness that's gone on in the past 14 years. We need to focus on staying here, on continuing to provide these services. That's why M&A represents nurses and healthcare professionals, and we will work on every level and do whatever it takes to find a way to keep on doing what we do. back in the 90s, the legislature pretty much abdicated responsibility for healthcare in the Commonwealth and permitted hospital deregulation and let these for-profits come into our communities. And they were given free rein to deliver, to decide what to deliver and when and where to deliver it. And that's not worked out too well for us. I mean, we've lost dozens and dozens of maternity beds and behavioral health beds, detox beds. Virtually every promise that Steward's made has been broken in some way, shape, or form. But that doesn't mean we don't need to keep on doing this hard work and working with anybody, politicians, legislators, whatever it comes to. The M&A and the healthcare professionals at M&A will continue to do that work with everybody. We can, I think we can turn this around. I think we can make this better. I think we can avoid what we did 14 years ago and sort of surrender our care to a company that clearly was much more interested in profits. And we can get focus back on taking care of patients, marginalized patients who are in desperate need of our care. We can't have any more talk about closing hospitals or diminishing services. There's been enough of that. We need to get on with the hard work of making sure that we continue to take care of everybody. And thank you so much. Thank you for your time.
Mrs. McInnes, thank you so much. Jesse Burns, I understand you're on the phone here. You now have the floor, sir.
Yes, I am. Thank you. Hello, everyone. My name is Jesse Burns. I work here at the Kearney Hospital. I think that it's important for me to speak here today because I am lucky enough that I work in regular patient admitting on the main floor here, but I also work in the emergency room with admitting, whether it's in the front at the main desk, the first person you see, or in the back coming in via ambulance. As you all said, we have transport coming in from other hospitals, bringing them to St. E's, from St. E's to here, or vice versa, or many other facilities as well. These communities really rely on this hospital as a whole. And recently, I've noticed a lot of people skeptical to almost come in due to what is happening in the news. I had a young girl, maybe her early 20s, come in recently and say, "Are you guys still open?" I said, "Well, of course we're open. We're 24 hours. It's the emergency room." People are nervous and they're not knowing where to go to seek their care anymore because of the bad things that are coming through the news and what Steward has, proposed. So I think that it is important for us to try to keep this funding and, just to continue being a part of this community. As workers here, we do care about these communities. We care about the families and our friends. But however, we are also part of these communities. We are patients here as well, that our care, we would have to seek care elsewhere along with employment. This goes all over the place. These are things that we just need to continue to be. And, I think that it's very important that we meet with you guys and that you guys hear us on our end as well. And I really do appreciate your time.
Jesse, thank you so much, and appreciate you taking the time to come here as well. Maureen Raitt, I believe you're over the phone as well. You have the floor.
Good afternoon, everyone. Thanks for the opportunity to speak here on my thoughts on Kearney. I'm born and raised here in Kearney at Dorchester. I joined this Kearney family in 1979, so I'm one of your decaders. When I started here, we were a 400+ bed hospital. I served trays to those patients in those beds. Now we're maybe a 100-bed hospital. But our 100 beds are so important to this community, it would just be devastating to see them go. I want people to know that Kearney has plenty of room for more beds, more doctors, more surgeries. We just need them to come back through our doors. And doing that is getting us someone else to take us over and help us out. Our patients are very important to us here. To me, some of them have been coming here as long as I have been. Being sick and needing medical attention is a scary situation. But coming here through the doors of Kearney, where everybody knows your name, really alleviate some of that scariness. So what we're asking as employees of Kearney, because nobody told me I couldn't come here today, is to help us stay here in this community and serve the people that have been coming here for decades. I thank you for your time.
Maureen, thank you so much for taking the time. Lainey Marr, nurse at the Kearney Hospital, you now have the floor.
Hi, everyone. Thank you for having me. My name's Lainey. I'm one of the nurses in the emergency department at Kearney. Prior to working at Kearney, I worked at Norwood Hospital until an unexpected flood resulted in its sudden closure. That experience, I witnessed what happens to a community when it loses its hospital. Speaking with many of my colleagues working at surrounding hospitals, I've heard the horrific stories of the overcrowding and boarding of patients as hospitals throughout the state really struggle. Now working at Kearney, I once again see a community, my own community, threatened with the loss of its hospital. The hospital is essential in protecting the health and well-being of its community, and it is also a major employer staffed by dedicated staff, many of whom have invested decades of service to their community. Community depends on this hospital for routine and emergency care. Our ED alone sees approximately 80 to 100 plus patients a day on average. There's no lack of demand for services, especially cultural competent ones. Kearney has many Haitian and Vietnamese speaking providers and staff to cater to the cultural diverse community of Dorchester. Recent stories in the Boston Globe highlight excessive wait times for patients seeking emergency care. If Kearney were to close, there is no way the surrounding hospitals could accommodate the potential overflow of patients. It could potentially be catastrophic. We cannot allow this to happen. Thank you for your time.
Lainey, thank you so much for your time and coming in to testify as a panelist as well. There was one more. I do not know do we have Ada Heliage with us on the panel? And if not, I think that concludes the presentation from the panel. So thank you to all our panelists. I'd like to acknowledge the sponsors to begin with the first round of questions, and then I'll turn my floor over to the colleagues in order of their arrival. So Councillor Braden, the floor is yours.
Thank you, Mr. Chair, and thank you to all the staff from the Kearney and St. Elizabeth for your testimony today. I was visited St. Elizabeth 2 weeks ago and was very, very impressed with your professionalism and commitment to continuing care despite the incredible that the organisation is facing right now. So, Mr. Chair, I just wanted to go on the record to state for the record the details of the existing regulatory process for the closure of hospitals, hospital essential services, which Dr. Ojikutu referred to earlier. We want to reassure our patients, workers and community members that closure is not imminent at the moment. The hospitals aren't closing, just like our nurse just mentioned. People are coming and saying, are you open? Yes, our hospitals are open. And hopefully they will continue to be open for the foreseeable future. If a hospital operator intends to close hospital services, current Department of Public Health regulations require certain steps. This is specific to closure and not transfer to another operator. There's a requirement for 120 days before the proposed closure. They must notification of the intention to close, also notify patient and family council, hospital staff, labour organisations and state and local officials. 120 days out, so you're talking about 4 months. 90 days before the proposed closure, the organisation steward would have to provide utilisation rates for services, describe the impacted area, and detailed account of community engagement and how they're going to plan for their closure. And 60 days before proposed closure, the Department of Public Health must hold public hearings with 21 days notice. Hospitals must describe plans for alternative access to services. Within 15 days following the hearing, Department of Public Health makes determinations of whether services to be discontinued are necessary for preserving access and health status. And within 15 days, hospital must submit response to the DPH findings. This is the existing regulatory process and timeline. There are state bills proposing reforms to the hospital closure process, and we may actually need a specific Boston-specific process. With regard to transferring to another operator, we currently don't have, my understanding is that we don't currently have a regulatory process for transfer. And just as Dr. Sagan mentioned earlier, you know, it might require emergency state legislation or a declaration of a public health emergency. But just to reassure our patients and our communities, we're not there yet, despite the crisis that we find ourselves in. There's no imminent closure of any of our health facilities. And these dedicated staff turn up to work every day to provide quality care in incredibly uncertain times. So I want to applaud your commitment to service and the incredible care that you give, and try and reassure folks that there is a process and none of these hospitals are going to close imminently. Thank you.
Thank you, Councillor Braden. I do want to acknowledge that Ada, a panelist, was, I believe, just up here, and I do want to allow her a quick introduction before we turn over to Councillor Murphy. And so if Ada is back up, I'll give 1 second to see if we can pull her back into the panelist, because I know she was just up here. And seeing that not able to happen right at the moment, Councillor Murphy, the floor is yours, please, and thank you.
Thank you. And I do have to say, I don't think she's on still, but the nurse who spoke before Lainey, I definitely remembered her because my son, well, he's 24 now, but when he was in Little League baseball playing right behind the Kearney at Dorchester Park, you know, stole a base and broke his finger, and we had to go to the emergency room, but I remembered her right when she hopped on. I'm like, I know that nurse, she was wonderful. So it just goes to show that, you know, this is a community hospital, and we do use it. The one concern I have that I think is better to ask this panel than the one before is the concerns we've been hearing that the medical staff doesn't have the supplies and equipment they need because Steward isn't paying their vendors. And I would, like, are you hearing that directly, Carrie, from your employees or Ellen, the nurses, that they don't have the equipment they need, or it could get to that spot where that's dangerous, where they're not able to do their job?
I just wanted to flag that the person that you were referencing before is actually one of our members from 1199. Her name's Maureen, and she's a medical secretary, not a nurse.
Yeah, that was her, yeah.
Yeah, I just wanted to say that. We have heard from our workers that it's still difficult to get all of the supplies that are needed. We've heard just yesterday through our walkthroughs that sometimes it's difficult to get paper, water, some extension sets for IVs in the emergency room at Good Samaritan. But other than that, you know, I'm sure that there's more happening. We did hear that at one point medical supplies truck did arrive on site and delivered some supplies. So we're hoping that continues with DPH being on site. It is helping.
Scary. Reminds me of my days in the classroom. Although our children deserve some books and paper, but if we run out of paper or crayons, it's not life or death like this. So definitely something we on the council need to keep a close eye on, that we're not putting patients, but also employees in a situation that they're not able to do their job safely, because obviously there's a risk that you all take every day when you come to work saving lives. So unfortunate that you have to be going through this, and just know that myself, my office, and I know all my colleagues are here to support in any way as we work through this, and whatever ends up happening, that we'll continue to support whatever we need to do. So thank you for being here.
Thank you, Councilor Murphy. Just echoing my colleagues here in that the work you guys do, and talking, Councilor Braden mentioned just admirable work. My mother was a nurse, right? Utmost respect. I also think it makes the best moms, having a mom that's a nurse. It's unbelievable. I don't know what I'd do without her as a nana. But for you guys to keep showing up every day, just know that we are here fighting for you guys. We're here to keep this open and to make sure that the work continues. And Councilor Murphy, Councilor Braden, myself really care about this stuff and want to make sure that the services are provided for those who need it in the health-wise, and the workers are provided what they are so that they can do the work. And so I really thank everybody's time here. Ellen, I don't know, do you want to chime in with any final thoughts?
So, yes, thank you, Counselor.
No problem.
I'd just like to say we recognize the support and we appreciate it. We know all eyes are on Steward right now. Internally, we continue to struggle with staffing issues and with some supply issues. It takes 10 miles to stop a battleship. It's going to take us a while to get through this. While DPH is in the hospital and circulating, management's on their best behavior. And we are well staffed now, but we're also down patient volume.
Yeah.
And we will feel the impact of this. The dirty little secret of COVID. I spent 20 years as an ER nurse at St. Elizabeth's. I recently left and went to an inpatient medical detox unit. But the dirty little secret of COVID is nobody came to the hospital. There were nights in the ED where we didn't have any patients. And we're feeling the impact of that now. People didn't follow up, they didn't get their care, and this is, the stories of a few years old now, but there is indeed a tremendous impact from this, and I think there will be a backlash. We have to stop having the conversations about closing the hospitals, and we have to have the conversation about who's going to take over, who's going to be our operator, and whether that's, in my world that sort of comes with a little bit of fairy dust too, in my world that's some sort of nonprofit consortium that all the interested parties sort of put together and form. Or is it that each one of the hospitals gets picked off by a different hospital chain? Could BMC or Tufts come up with the money and sort of step in and share the resources? Because Connie and St. Elizabeth's both have tremendous resources to offer to the community. Anyhow, that's the conversation we have to have. Is not what happens if we close, but how are we going to stay open? And, like I said, internally, we're still having some challenges. I don't think that will change. I don't think that will change until, Martha Healy does a sort of Harrison Ford, get off my plane kind of action to Steward.
Thank you very much, Mrs. Mackins.
Thank you.
I believe that concludes all questions from my colleagues. So I'd like to thank the panel very much for coming on, all the folks from SEIU and MNA. Thank you for your time and for your dedication to this craft. We will now move on to public testimony. When your name is called, please accept the request to be promoted to the panelist, and please unmute your microphone. Please state your name, neighborhood, and/or the organization and affiliation you will be testifying on behalf of. Our first in the public testimony, we have a total of 3 people for public testimony. Our first, Dr. Monica Vora, you have the floor.
Thank you. Chair Fitzgerald, honorable members of the committee, members of the City Council, and guests, thank you for including us in this critical discussion. My name is Monica Vora. I'm first and foremost a primary care physician. I have the privilege of also being the Chief Medical Officer at Dodd House Health Center and a member of the Health Equity Compact. Dot House is a federally qualified health center located in the Fields Corner neighborhood of Dorchester. We've been providing comprehensive quality health care and social services for over 50 years. We provide care and services to over 20,000 patients annually, with almost 85% of our patients served living at or below 200% of federal poverty level. Just 2 miles away from us, Kearney Hospital has been a long-term partner of Dot House, particularly for patients requiring specialty and 24-hour emergency services. In the last 3 months alone, 365 Dot House patients were seen for emergency services at Kearney, and 15 patients had an inpatient stay. Many of our patients have shared with me that they seek care at Kearney because of its neighborhood-based location and language capacity. A large portion of our patients speak Vietnamese and have found great comfort in receiving care at Kearney by healthcare staff and interpreters that speak their language, often during periods of physical and mental distress. We know how overwhelming it can be to go to the hospital in the middle of the night, not knowing what may go wrong with you or your loved one. Imagine doing that and not being able to speak the language. We heard today that mortality rates in Dorchester are significantly higher than other neighboring communities. My patients have complex medical conditions that often warrant immediate emergency services. Every additional minute it takes to get to the hospital for someone having a stroke or heart attack is a matter of life and death. In thinking about prevention, the limited access to care during the pandemic has left many of our patients overdue for critical cancer screenings. Kearney is a key referral partner for us when it comes to colonoscopies for high-risk patients, second only to our primary referral relationship with Boston Medical Center. We know that historically marginalized communities, particularly Black men, have higher rates of mortality from colon cancer. The closure of Steward hospitals will undoubtedly widen these existing health disparities. As a provider of choice for many, as well as a safety net provider the city and state rely on in times of crisis, Dot House will continue to provide the best possible care to those who need it most. We've worked hard to improve primary care access for existing and new patients. We're working actively with DPH to accept referred patients who are currently living at the Melnia Cass Recreational Complex, and we are implementing a refugee health assessment clinic. However, the safety net can only stretch so far until it snaps, and without additional resources, the closure of Kearney and other hospitals within the Steward system has the potential to do just that. In the first quarter of fiscal year 2024, Dot House's volume in our urgent care clinic has exceeded our budgeted expectations, with close to almost 1,000 additional visits with no additional staff or resources allocated towards that. We will continue to do what we can. We have full confidence in our city and state government officials and see ourselves as partners in developing and implementing solutions to the fragile state of the healthcare system. Thank you for your consideration, and we look forward to working with you to ensure the continuity of care for the patients in our communities.
Doctor, thank you so much. And as the District 3 counselor, thank you so much for what all you do in the community as well. I appreciate that. Up next on the public testimony, we have Nicholas Mutter. Nicholas, if you're with us, will you please unmute yourself and please announce name and who you're with. Thank you.
Good morning, all. Good morning. My name is Nicholas Mutter. I'm the secretary for the BPPA EMS division. A couple quick remarks. Chair Fitzgerald, Councilor Braden, council members, thank you everyone for calling this hearing and discussing the impacts that will undoubtedly be felt citywide through all of our neighborhoods. Let's see here. I'm a resident of Dorchester, a patient of Kearney Hospital, a paramedic, and represent the EMTs and paramedics of Boston EMS. We act as a safety net for our residents, accessing both St. Elizabeth's Hospital and Kearney Hospital dozens of times per day. The staff there are compassionate, diligent, and save lives daily, truly embedded within our communities, playing a vital role in caring for our residents. I want to point out that these discussions should not be confused with a reflection of the men and women delivering care at these institutions daily. I've seen the life-saving work they perform. I've been a patient for several times. They do amazing work there. Our EMTs and paramedics have seen an increase of approximately 3.15% in the number of calls and a 2.3% increase in the number of transports, with approximately 7,500 of those in Alston and Brighton and 29,000 of those in Dorchester in 2023. A few quick points to consider, keeping in mind I'm trying to stay under 2 minutes here, is that St. Elizabeth's and Kearney hospitals are located in sections of the city which are geographic outliers, away from our other large hospitals and major points of entry. The ability for our ambulances to access these hospitals allows for quick turnarounds for the ambulances to respond to additional calls within the lower Dorchester and Alston Brighton neighborhoods. With the possibility of these hospitals closing, we are heavily concerned that the burden will be placed on other hospitals, creating increased wait times for patient transfers, often referred to as holding the wall, decreased patient satisfaction, and an overall backlog in the ambulances being able to respond to 911 calls within our neighborhoods, which will systemically place itself throughout all of our neighborhoods, not just the Alston, Brighton, and Dorchester neighborhoods. Additionally, access to primary care is critical in managing chronic illnesses and minimizing the need for inpatient hospitalizations. Losing those inpatient and primary care physicians would undoubtedly impact the overall health and well-being of patients of Kearney and St. Elizabeth's. An additional point to consider, Steward Hospital also maintains Good Samaritan, Morton, and St. Anne hospitals, all located south of Boston. Additional component to consider is that if these hospitals were to close or have other alterations in their ability to deliver care, Boston will bear the weight of accepting those patients as well from as far south as Brockton and Fall River, thus increasing the patients being taken directly to other hospitals within their Boston, such as Boston Medical Center, Brigham Women's, etc., exacerbating already bad wait times. We stand ready to collaborate with the city, Dr. Ojikutu, to expand our capabilities of mobile integrated health within Boston EMS programs, so we can deliver additional care to decrease the need for hospitalizations. Our request is that the leadership of the Steward Hospital Group participate in these difficult discussions with elected officials and state health officials. We encourage transparency and demand that we put our people and our patients above profits as these decisions are made in deciding the future of the institutions in Boston. Thank you for the opportunity to speak.
Nicholas, thank you very much for taking the time to be with us here today. Lastly, Anna Leslie. Anna, you now have the floor.
Good afternoon. Thank you. I never think I'm going to testify or provide comment, and then I do. So my name is Anna Leslie, and I direct the Alston Brighton Health Collaborative. And St. E's was actually was the founding funder for our organization through the determination of need process through the state. We are one of the organizations mentioned that are in some cases preventing people needing to go to the hospital in the first place by providing preventive resources like healthy food access, resources, community connection that prevents isolation. And since St. E's initial funding that was granted in 2013, they have over, that was 5 years, precipitously decreased funding over the years. We have recently, very recently, fortunately resolved the issue of a lack of commitment of support that was granted in 2022 for our farmers market coupon program. That has been resolved, and we're very fortunate and thankful for that. I do want to specifically thank St. E's current president, Paul Smith, who I know is working really hard to support his staff. He is, I think, in the middle of a remarkably challenging situation. When Paul was the CFO during the COVID-19 crisis, he worked really hard to get many of us vaccinated, including myself. But I also want to call up that in 2019, at a public BPDA hearing at St. E's and in front of St. E's leadership and elected officials, staff at St. E's used that opportunity because they clearly had not been heard at all since then or before then, to describe the lack of basic supplies at the hospital, doors not locking, lights not working. So there were issues, certainly pre-COVID at that facility. And the response from the administration then in public was, you know, please don't use this space. I'm sorry about this. We can discuss this. So these issues have been long known. And so I am very concerned that St. E's was, and others were continued to be given new approvals to move its institutional master plan forward, that it was allowed to move forward with plans to build and develop more without addressing some of these basic needs. I echo Mr. Mandarini that we really are not getting enough information from the state, and certainly that goes for all of you, but it goes for us too at the community level. We don't know what's going on, and we aren't getting a concise understanding directly from people that represent us in the state. In terms of what the city of Boston and the mayor's office does have control over, and this was mentioned a bit, the need to understand and map services and resources in our neighborhoods and communities points directly to our need to have robust and accurate and census tract driven community health assessments, both of needs and of assets. And these should be driven by the Health Commission and in partnership and with support from other departments like the BPDA. These should not be driven by the BPDA. These should be assessments done by the Health Commission to assess not just what are the number and types of beds, but the locations of these providers, their relevance, the languages that they speak, the services that they provide, the insurance accepted, and more. It's really concerning to me that these were not prioritized in the Alston-Brighton needs assessment. I think we could have brought to light a bit more of the St. Elizabeth's challenge that we're in now if that had been addressed earlier. We're in Alston-Brighton about to go through a neighborhood planning process, and we will ensure that healthcare access is really thoroughly examined, but we're going to need help doing that. And so I really call on the administration and the city council to think very carefully and specifically about neighborhood planning and community planning. And that really does involve healthcare and how we get healthcare and how much does healthcare cost and who is it for? And that we don't think necessarily just about districts, but census tracts and how people move around the city. So that is my call to what the city can be doing about this. There's not much we can do about where we are now, but how we move forward is very much about planning and how departments are working together. Thank you.
Anna, thank you very much for those comments. That concludes the public testimony. And just in closing, I'd like to say that thank you to everyone who attended as a panelist or to give public testimony, to all my colleagues who stuck through till the very end of this very important hearing. We will continue advocating on behalf of all parties, the workers and the patients, and trying to continue to get as much communication out there to you all. But thank you very much. I appreciate you all. This hearing on docket 0191 is now adjourned. Thank you.